All right, I think we are live. Yeah, great. Good afternoon, everyone. Good afternoon, good morning, and good evening to everyone around the world. And welcome to this webinar that we're bringing you today. Today, we're talking about the future. We're talking about leadership. And we've got amazing leaders that are with us on the call and the webinar today. So it's really going to be an impactful event. It's going to be an impactful webinar that we have today. And it's going to be chaired by myself and my colleague. I'll give my colleague to introduce herself first, all the way from Uganda.
Hello, everyone. You are most welcome to this webinar, and this is one of the most important webinars of Nursing Now. We are indeed delighted to have you and grateful for the journey that we have moved it together, and today as we do transition from Nightingale Challenge to Nursing Now Challenge. Thank you very much. My name is Naiga Harriet, a midwife from Uganda. I'm the founding director of midwife-led community transformation, MILCOT. MILCOT is a community-based organization that focuses on prevention of teenage pregnancies and unplanned pregnancies through provision of sexually reproductive health and rights to marginalized adolescents and young adults. We are doing our Nightingale Challenge in partnership with Burdett Trust for Nursing. We are indeed grateful, and we are building resilience of nurses and midwives in our country towards the provision of efficient and effective preventive service delivery. And we are focusing on provision of adolescent-friendly sexual reproductive health services. Thank you very much, Monashe. It's indeed grateful to co-chair with you, and we are going to have a line of speakers. We can't wait for this. Thank you very much. I hand over to Shirley to continue from here.
Hello, everybody. Thank you to everyone joining this webinar today. We are all excited by this programme, which is continuing as the Nursing Now Challenge. Let me now give you a little talk about the Burdett Trust for Nursing, for those of you who don't know. The Burdett Trust, since the beginning in 2002, has supported nurse-led projects. It uses its funds to empower nurses and make significant improvements to the patient care environment. Since 2002, Burdett has awarded grants totaling just under £50 million, an amazing amount of money for nurse-led projects. The trustees target their grants at projects that are nurse-led and focused on supporting the nursing contribution to healthcare. The three key areas are building nursing research capacity, building nurse leadership capacity, and supporting local nurse-led initiatives. The Nursing Now Challenge fits nicely within the second category, building nurse leadership capacity. So from the beginning of the Nursing Now campaign in 2018, the Burdett Trust has supported this movement to unite nurses and health advocates from around the world in this first ever global movement to champion the role of nurses. Nurses are born innovators. Of all clinical groups, nurses, midwives, and allied health professionals work closely with the largest number of patients at every point of the care journey. This contact gives them a unique understanding of how to make a positive impact to patient care. And we have seen over the last year truly inspiring work from nurses everywhere, working in extremely difficult conditions. The Burdett Trust is proud to support the Nightingale Challenge since its launch and will continue to support the leadership development of nurses and midwives around the world through the Nursing Now Challenge. The programme focuses on leadership and will help nurses to innovate and flourish. The Burdett Trust is proud to be supporting this important initiative and to improve health globally by empowering the nursing workforce. The Nursing Now Challenge will accelerate the early career nursing leadership agenda by working with health employers around the world to create development opportunities and positive practice environments in which the skill of early career nurses can be harnessed and used to its full potential. The Burdett Trust is committed to improving health globally, and we believe that the way to do this is by supporting and empowering the nursing workforce. I have been delighted with the success of the Nightingale Challenge, in spite of the challenges of the COVID-19 pandemic, and I am looking forward to this next chapter as we build this global momentum and commitment to nursing. Thank you.
Thank you so much, Shirley. And really amazing to be able to hear from you this afternoon. And really great to be able to have all your support towards the Nightingale Challenge and the future of nursing and building nurses at the center of healthcare for the future. We'll pass on to our next speaker, who is going to be able to highlight more about the Nightingale Challenge and who is an amazing colleague, Professor Lisa Bayless-Pratt, the Program Director for the Nursing Now Challenge. Great to see you, Lisa.
Great to see you too, Manashi. Thank you so much. And I'm going to talk to you a little bit about why get involved in the Nursing Now Challenge moving forward. But I challenge anybody to say, what's not to like? I mean, I feel so very proud being here today. We launched the Nightingale Challenge back in Singapore in 2019, and we thought, gosh, 20,000 people engaged would be amazing. But to end up with over 30,000 just demonstrates the appetite and the talent that's out there. And then over and above that, just to think that Harriet and Manashi, we didn't know each other 2 years ago, and here you are chairing this fantastic webinar with all of these eminent people on the panel and listening to us. It's truly game changing. So there's so many opportunities to get involved in the Nursing Now Challenge, and I'm very grateful to the Chief Executive of Burdett, Shirley, for continuing to support this and being such an amazing champion as well throughout. Being a non-nurse, learning more about what we do globally and the impact that we have is truly welcome. So thank you so much for that, Shirley. So if I could have the next slide, please. So I'm really delighted to say that from June this year, the Nightingale Challenge will become the Nursing Now Challenge. And there's just a couple of reasons for that that's worth flagging, I think. One of the main reasons is that the Nightingale Challenge was specifically designed as part of the celebrations of the 200th anniversary of Florence Nightingale. So it was absolutely right that we called it the Nightingale Challenge then. But I think as we move forward, and we know there's some fantastic nursing leaders out there, Mary springs to mind, and Edith Cavell, and there's lots of other ones in different countries. We thought that actually the Nursing Now Challenge would be an appropriate term. But I don't want anybody to lose the Nightingale Challenge pioneering community that we've created. And we'll be transitioning very smoothly and continuing to learn the lessons from that. But the idea is to build on what we've learned thus far and to really create leadership development opportunities. So wait for it. I don't know why we set this, but we did. 100,000 people across the world that are nurses and midwives to really engage within this agenda. We do believe it's scalable. As I said at the beginning, we thought 20,000 was ambitious. We got 30 and we think we can go further. We absolutely think there's something about engaging student nurses, and we've talked to our our new board members about that possibility. And I think there's also the opportunity to really strengthen other participants' involvement that perhaps aren't early careers, so that they can provide role modelling, mentorship and support for our early career nurses as we move forward. So what I would say about that figure is watch this space, because, you know, it's a tall order, but I think there's a massive community out there that cannot wait to support the work that we're doing here. Next slide, please. So the purpose of the Nursing Now Challenge, it very much builds on the work that the whole Nursing Now campaign has been doing since 2018. And that's very much at its heart. It's raising the profile, power and potential of the profession, but putting the spotlight in this instance on early careers, so that we can enable early career nurses and midwives to really step out and step up to leadership development opportunities, to be taken seriously, to be invested in, and actually to show their seniors and to show others that they can be taken seriously. And we have seen that throughout the Nightingale Challenge programme. The two chairs today, you know, they can give you hard evidence of influence in practice. In some instances, it gets securing external funding, raising the profile of what they're doing, and most importantly, improving the healthcare within their local communities. So we've got case study after case study that shows us this is possible, but we now really want to amplify this to as many countries and as many significant players as we can across the world. And I think we will do this through creating a really strong global network of early career nurses and midwives that feel truly empowered and have a safe place where they can come, they can talk, they can engage, they can share and they can connect. And only this week I was speaking to some fantastic Nightingale Challenge participants in Ireland that were really excited about joining this network. I often tell them about Menashe and you, Harriet, and they couldn't wait to say, how do I connect and what can we do together? So we see this Nursing Now Challenge strengthening that network, but providing early career nurses and midwives real tangible opportunities to engage with each other in different countries, because despite what's going on for us all, and I think COVID has shown us this, there's much more that binds us together than sets us apart, and through binding together we become stronger, I think, as a force for change. Next slide, please. And you know, our overall aim remains the same really as it was, but I think with that focus, and we want to build that evidence base, working with and through others to see how can we help to accelerate early career nursing leadership. How can we make sure that early career nurses stay engaged? We know across the world we lose far too many nurses and midwives. Everybody struggles with attrition and how do you keep people? And we really want this to be one enabler for employers and early career nurses and midwives to stay engaged within the profession, to stay energised with the people that they care for, and to have that ambition to pioneer and try new things out that delivers more and better healthcare for everybody. So we're absolutely committed to that. There's lots of us and we need to work together to be strong together and to stick with the work together, especially when things get tough. And again, through COVID, you know, I had lots of feedback when we put on some of our webinars for early career nurses who's just said to me, thank you. It was really nice to have a break from talking about COVID. Thank you for giving me an hour to listen to what's going on in different countries. So we really see ourselves as part of that support infrastructure for nurses and midwives everywhere. Next slide, please. And the other thing that we're really keen to make sure we keep an eye on is that policy piece. And I'm pretty sure that Maureen will talk a bit about this later. Fantastic Maureen Bisanyago, who has done some amazing work. So privileged and lucky to have people like her that are engaged with us in this. But how do we make sure we position some of our work to influence policy? And how do we make sure that the World Health Organization are aware of what we're doing, that we work with other international partners? And it's really interesting that even in these early days of people finding out about the continuation of the Nightingale Challenge, they've reached out to us and said, oh, we've got this interesting project going on in this particular country. Do you think your network might be useful to us? So we really want to, as well as support these early career nurses out there, midwives, help to shape the policies for the future, help to build the evidence. And then I think we can start to really see that increase in investment opportunities that will come along. You can't get away from the triple impact. You know, it makes absolutely perfect sense that we want health for all, we want gender equality and strengthened economy. And I think that's something that we will absolutely stay strong to. And the other bit I think that we're trying to build into this, and we've got some exciting information that our colleague Professor Aisha Holloway has led on, which is around the data and intelligence building around this whole campaign. It's just how exciting you all are, you know, out there delivering nursing and midwifery, and that it is a fantastic career. And how can we help employers, how can we help careers people to see that nursing is absolutely exciting and rewarding for people to get involved in. So we're keeping a close eye on that one too. Next slide, please. And the Nursing Now challenge as we move forward are just sort of, I don't, you know, we've got these quotes up here, and it is probably just worth just mentioning one or two, but we've got hundreds of these. But for example, you know, the one that's up to my top right, you know, I've developed by taking more of a lead on projects and making sure everybody's opinion has been heard. The Nightingale Challenge was very supportive. It helped me to become more confident in communicating. And this one, over the past 10 years, I've worked under inspirational and influential nurse leaders, and being part of the Nightingale Challenge has encouraged me to grow. Well, as I said at the beginning, what's not to like about this? Why wouldn't you want, whether you're employing nurses and midwives, whether you're one yourself, why wouldn't you want to support this sort of feeling, this momentum about our wonderful profession? Next slide, please. And that keeping the promise, you know, we'll be staying very close to the principles of a lot of what the World Health Organization talks about, is how do we really make sure that we get health for all? How do we get that investment in nursing and midwifery? And we look forward with the network to do some more detailed work on the state of the world's nursing report. What does it mean to us a year on? And where do we want to go with this? How do we want to influence it? Where are the pioneering nurse-led clinics, specialist nurse, midwifery services, primary healthcare, etc., etc.? So I think through being connected and through people having the opportunity to share with us what they're doing, we can amplify this and really get the change that we know we deserve to see, which is more investment and more health for all. Thank you. The Nightingale Challenge figures, really there they are up there for you. We're delighted with those figures. We're working really hard to understand, you know, who's been involved in the first set of sign-ups, who's continuing to deliver the programmes, and what new programmes are we going to get on board. But we do keep a close eye on this, and we want to continue to grow this network. It's really important that we build that capacity and the capability, and that it is scalable across the world. And I just want to say a huge thank you to some of to all of the board members of the Nursing Now and the future people that have stepped forward to help us take this forward, because without these influential leaders in different parts of the world, we would not have achieved this. And I think that really speaks to the importance of the mentors, the role modelling, and how they can help early career nurses. And indeed, the early career nurses can reflect back what they're faced with as well. So this is an absolute joint effort amongst all of us, and long may that continue. Next slide, please. And in terms of what we've learned so far, well, it doesn't feel like one slide can possibly do it justice, but I think in a nutshell, what we have learned is that people want this. There's a real appetite to network and connect. We know there are amazing early career nurses and midwives out there. They're in their droves. But what we know they need is they need our support. They need some attention. They need a platform. They need a safe place. They need mentors. They need role models. And that's exactly what we'll be doing with this next phase of the challenge. So I don't probably think I need to say so. It's almost like, what more can the Nursing Now Challenge offer you? But as well as all of that, as well as being part of this fantastic movement, this powerhouse of potential change and the ambition that's there, we've also got some practical things that are quite useful. And we do have online resources. We as a university at Coventry, which is where the challenge is housed, we have lots of opportunities to share our learning materials, to share education resources, to tap into library services, the latest evidence. So we're really lucky to have that sort of university infrastructure to call on to help people build evidence base and to learn new things and to have the technological support. I'm absolutely delighted we've got 2 strategic partners as well, Health Education England and the Tropical Health and Education Trust, and I won't steal their thunder because they're soon to talk to us. And we've also got online leadership courses that we can help you to develop. So there's lots of stuff that we can also give as resources for you to explore, for you to personalise. And I've never forgotten what Lord Crisp said to me when I very first started on this work, and it was so true. He said, it's really important, Lisa, that whatever you do, you go to the countries don't come to you. And he's absolutely right. We are not here to tell you what to do or how to do it. We're here to offer advice, support, and a plethora of resources that may or may not work for you within your local situation. And we learn as much from you anyway as perhaps you do from us. Thank you. Next slide. And then we've been doing this other work, which I'll just give a flag to now, but it talks about where our partnerships are going and how proud I am that we've been able to not only get fantastic early career nurses on board to take on particular global solutions and end up winning, but the people we've engaged, the charities that we've engaged, and the different organisations that want to work with us. And this is something I really feel passionate about, that we're always stronger when we connect with others, and we'll be continuing to partner with different people in different ways to get maximum output for what we're trying to achieve. So just within this short time, we've achieved partnerships with Salus, with Nourish, with Jaya, Same You, and there's lots more to come, as you can see from the left-hand side of that slide. But I think giving early career nurses the opportunity to throw a challenge out and see what you come up with, and then see how we can support you as part of your professional development, is absolutely a recipe for success. So you'll be seeing more of this as we move forward. And we do hope as well at some stage to bring together all of these winners and have a really exciting event about what they've done with the solution that they're taking forward. Next slide, please. How to accept the challenge? Well, there's just a very quick step here, but please, all of you that are listening, if you haven't accepted the challenge, please do accept it. Go and talk to your employer, go and talk to your manager, go onto our website and start getting involved. We're here to help. As I say, we're about facilitating your success, and there's lots of ways that we can help you join this community for all of our benefits. Next slide, please. And again, this slide really just says, well, how further can you support us? So it's absolutely about reaching out to your manager, to your employer. It's about promoting the challenge in different places, hosting a meeting, really just talking up this fantastic opportunity that we've all got in order to really show the value and worth of early career nurses and midwives and what they can bring to the table in order to effect positive change within their communities. So thank you so very much for all of your support. I'm really excited about this next phase. I feel hugely privileged to be able to have this opportunity, and I will do everything I possibly can to make it a huge success, building on what we've already learned. Thank you. I think it's back, Harriet, to you now.
Wow, what an amazing speech to us, Lisa. Thank you so much. Your voice always brings hope into the nursing and midwifery profession. And at this moment, allow me to say thank you so much on behalf of all the young nurses and midwives around the globe. Monashe and I are just examples of them, and you have seen what we have brought to the table. You have supported us, you have empowered us, you have nurtured us, and today we have a different smile. We are so happy that we can contribute to healthcare in our countries and we can be recognized. I can just give a short testimony of a young nurse who is among the Nightingale Challenge nurses whom we are empowering at Millcourt. Yesterday, she just gave me sad, good news that after our speech to them, after giving them the information about Nursing Now Nightingale Challenge, her hope came back for nursing and she applied quickly. She is now doing her bachelor's of nursing.
Fantastic.
So nursing now is an answer to those who are losing hope in our profession, and that is real. Thank you so much.
Thank you, Harriet.
And we want to say thank you so much to Burdett Trust for Nursing. At this point, allow me introduce Louis Grath, the Director of Programs, THET. He's going to introduce to us developing global partnerships to strengthen nursing and midwifery workforce. You are most welcome, Louis.
Thank you very much, Harriet. I'm not sure whether my colleague David was going to actually speak slightly before me. I'm happy to speak now if that's convenient, but just to check whether, David, you were planning to speak before me. Sorry, everyone, and welcome, and nice to see everyone.
Yeah, nice to see everybody. I don't mind, Louise, really up to you.
Okay, well, let me proceed in that case. Thank you very much, Harriet, once again. So I'm the Director of Programmes at THET, the Tropical Health and Education Trust. I do have a presentation, so let me just share my screen so you can see that. Oh, I'm showing you my emails now, which you don't want to see, do you? Can everyone see that? Is that clear? Yeah, fantastic. So yes, I'm the Director of Programmes at the Tropical Health and Education Trust, which is a UK non-governmental organisation. And so this is a rather busy slide, I realise, but I'll go through bit by bit to help explain it. So THET has as its core an aim to be strengthening the health workforce and the health system within which the health workforce operates. And obviously nursing and midwives being a core part of that health workforce. We undertake this work by three. I'm just going to give a bit of background to the organisation first before getting into the role that THET is playing in the Nursing Now Challenge alongside Lisa and colleagues from Health Education England. So we undertake this work in three ways. We have country programmes and a country presence in 10 countries, and these can be seen on the little map at the top. And through our presence on the ground in those 10 countries, we work very closely with the ministries of health, the key health institutions, be they health training institutions, universities, etc., but also the professional associations and regulatory bodies, etc., including, of course, the nursing schools and the nursing councils in the respective countries. And through those relationships, we then design and deliver programs in response to the priorities that we feel we're best placed to respond to. We also run a number of grants programs. So these are programs where we support others to address the priority needs in the countries where they're working. And that can be above and beyond the countries where THET has a presence. So the map on the bottom, or the picture on the bottom, gives a sense of the spread of the work that THET has supported through some of the funding schemes we manage. So showing that in a previous program we managed, we were supporting partnership activity in over 30 countries, covering a breadth of health themes, over 12 themes covered, and working with a number of cadres, including, of course, nurses and midwives, who have always been at the fore and the centre of the health workforce that we've supported. As well as those two first pillars, we also have a strong policy and advocacy focus, working to strengthen the ability of the actors we work with to achieve their aims, but also to particularly enable the model of intervention that we champion, which I'll come on to next, which we call the health partnership approach. So let me come on to the next slide, which is to give a bit more background on what we mean by health partnerships, because this is the way that we deliver all of our work, is through these partnerships. So health partnerships are a model of intervention that is a partnership between UK health institutions, so that's hospitals, trusts at the geographical area. It's also the professional associations and academic institutions that work with their peer institutions in a range of lower and middle income countries, or LMICs as we sometimes call them. THET's been doing this for over 30 years. And these partnerships, which THET champion, are partnerships where people come together to work together to identify solutions to the priority health workforce and health system needs that are identified on the ground. And these are long-term relationships between institutions and individuals, and they aim to bring about sustainable change for the priorities that have been identified. They're usually volunteer-led, so there might be some staff capacity on either side, but the intervention, the support, is normally provided by volunteers, be they nurses, doctors, dentists, etc. And we recognize that these are mutually beneficial partnerships. So obviously the driver is to bring about positive change in the lower middle income country, but we recognize that by engaging in these partnerships, the UK nurses, midwives, etc., also bring back benefit to their own practice and to their own health system. We very much focus through these partnerships on multidisciplinary team working, recognizing the benefit of that form of working. And this model of intervention is supported, endorsed by the WHO, by the UK government, and a range of European partnerships. And all of our work is underpinned by 9 principles of partnership, which really ensure the quality of the work, really embedding it in locally owned initiatives that are aligned with national priorities and bring about the equality of those partnerships. So that's just a bit of a background to THET, who THET is and what THET does and for what purpose. I'll now just give a quick highlight of the breadth of the relationships THET has because of the model we have. We very much sit at the heart of a range of institutions and partners working in support of the goal of strengthening the health workforce. That's just a quick overview. And in terms of the work that THET has been involved in and will proceed to be involved in relation to nursing and midwifery, as I mentioned, it's been a core part of a number of the projects and programs we currently run, including a new grant program that THET is running at the moment, the UK Partnerships for Health Systems program, which has at its heart a commitment to fund at least £5 million worth of activity to strengthen nursing and midwifery priorities identified through the program. We are very, very pleased to be part of the Nursing Now Challenge, which the Nursing Now initiative is something that THET's been very honoured to support from the very beginning. And we are thrilled to now be able to engage very actively in contributing to this very exciting initiative in partnership with Coventry University, led by Lisa and with HE, and we'll come on to a bit more of that in a second. But we are also extremely thrilled to have recently been awarded some funding from the Burdett Trust, which supports what we're trying to achieve in the UK Partnerships for Health Systems programme, but will enable us to give a particular focus to strengthening nurse leadership by supporting some fellowships for nurses, both in the UK and in some of the partner countries we'll be working in. And across THET, we're aiming to really raise the profile of nursing and strengthen nurse leadership as a core element of the work we're involved in. So just as a quick final slide to draw out the specific role THET will play in the Nursing Now Challenge and the work that we're doing with Coventry and with Health Education England. THET will be in particular providing in-country support in the lower middle income countries where we have a role to facilitate the activity on the ground. And I won't go into the details because David will come on to describe that. But we will be helping to ensure the activity on the ground links to the key institutions in each of those countries, including the Nursing Now leads and the ministries of health as appropriate. We will also be facilitating the people who will be involved in the initiative to undertake that and trying to overcome any challenges. But I won't go into the detail because David will be describing that shortly. Thank you. That was a bit of a whistle-stop tour, but hopefully that gave you a sense. Thank you.
Awesome. Thank you so much, Louise. And really amazing to hear about the importance of partnerships in being able to strengthen the nursing and midwifery workforce. And really amazing to hear about all that THET is doing towards that. So it's really great to hear from you. We'll hear from our next speaker, who is the Global Engagement Education Lead for Health Education England, and that's Mr. David Keane.
Thank you, and hello everybody. It's great to be here, and it's great to watch some of the chat happening and see how many parts of the world are represented. It's really awesome. Right, I want to try and share my screen. Okay, is that good? Can everybody see that? Yeah. Okay, so thank you. Yeah, so my name's David Keane, and I'm the Senior Lead for Education in the Global Health Partnerships Directorate at Health Education England. So a very brief overview. Health, for those of you that might not know us, so Health Education England is part of the National Health Service in the UK, and we are in charge of the education and training of healthcare professionals within England. Now we work globally because I think COVID has shown us all that no health systems work completely independently of each other, and that we are all interconnected and linked. So the idea is that in order to support our healthcare workforce more effectively, we need to form partnerships and work and learn from each other, from different organisations, from different governments all over the world. So that's why we have a very global perspective. I'm the programme lead for these talent groups, which I'm going to tell you about. And I'm also lucky enough to start my PhD next month, and that is looking at leadership in nursing. I'm a nurse by background. I used to work on a specialist liver unit in South London, where we cared for people who had liver transplants, who had had hepatobiliary surgery, and who suffered from chronic and acute liver disease. You've got my Twitter handle there, and also my email address, which will be at the end. So please do get in touch with me if you've got any questions about anything I'm going to talk about. So the talent groups. So talent is an acronym, and it stands for Technically Assisted Learning and Education for Nursing and Midwifery Teams. So not much of a mouthful for you there. But these are groups that are looking to bring nurses together into virtual communities to talk and learn about leadership. So the idea is that the groups will be moderated and coordinated by senior nurse leaders, and that the nurses come into that space, a safe space, to discuss problems, to help each other, to coach and mentor each other, and to learn from each other. And that the idea really is that goes both ways. So just because you're a senior nurse leader in a region or in an organization, it doesn't mean you know everything about leadership, and there's always things that we can learn from our colleagues who are still or just finished their training or at the beginning of their career. So the real idea is that all Health Education England will really provide is some resources and some support for the moderators, but the groups are very are much self-led and self-directed, so that the nurses within those communities are talking about and learning about things that are relevant to them in their organisation or in their region. The aim of the project is that we have about 20 virtual communities set up and established over the course of the 2-year programme, and we'll have another community where we bring all of the nurse moderators together. So that's linking then all of the groups that will be set up globally, and making sure that we meet that need to be interconnected, so that we can truly learn from each other, really, and start to build on the great work that the Nursing Now projects have already got going. This is an example of some of the countries we may work in, so please don't be alarmed if yours isn't represented. I was looking through the chat, and there's lots of people here from different places that aren't highlighted here. But again, get in touch with me if you think that you'd like to see a group in your region, and we can explore that. But really, this highlights that we're the global nature of this project. I won't spend too long on this because I only got 5 minutes, but really just to highlight to everyone that we're in the startup phase at the moment. We're setting up our platform and the resources and the support for the moderators. And in June, we've got the launch date when the groups will go live. Over the next few months, next few weeks, I'm sure you'll have some updates from the Nursing Now team about how to get involved and how to put your name forward if you're interested in joining one of these groups. So that's it. So that's thank you from me. This slide really just demonstrating there the different organisations that are involved in this particular project. So a real partnership there, and you've obviously heard from THET and the input that they're giving. So thanks very much. Thanks for your time. It's really great to come and talk to you.
Thank you very much, David. It's been really nice to hear from you with that amazing presentation, and it is of good help to us all. Right now, I'm introducing Maureen, and she's going to lead us through the panel discussion of different panelists. And allow me introduce Dr. Grace Edwards in her absentia. She has been unable to be part of us, but I have to introduce her because she's my mentor. And at this moment, I love to encourage all nurses and midwives, the young nurses and midwives who are on this webinar, that we need mentors. Dr. Grace has been so supportive to me in the work that I do and also in my personal development. Without a mentor, it is hard to get to the right direction. We need the people who are where we want to be. Thank you very much. Please, Maureen, go ahead.
Thank you so much. And I'm delighted to be with you all here, morning, noon, or night, because I feel so passionately about this subject. And I thought I would begin before I introduce the panel by just telling you why I feel so strongly about this. I started my career as a nurse in the operating room, operating theater, as you say, and I then went to work in the intensive care unit. And I remember that I, as a young nurse, could see things that people who had been in the hierarchy for a long time didn't see anymore. When I was walking every day into the intensive care unit, I was walking through a very empty pediatric unit, a new building, beautiful pediatric unit, maybe 2 patients out of 14 every day. But when I got to the intensive care unit, it was completely full. Patients in the hallway, patients waiting in the emergency department. We had terrible problems of over-bedding in the ICU. So one day I was reading an article, a journal article about creating, this is how old I am, creating a progressive care step-down unit that wasn't as acute as the ICU. And I had the idea that if we took over the pediatric unit, we could solve the problems for the ICU and for the emergency department. And I had great and bad experiences. First, I went to the head nurse of the unit and she said, no, don't say that. Because I think a lot of times as nurses go up the hierarchy, in the old days anyway, they were taught to just do what they were supposed to do. And they weren't supposed to see and solve. But I kept being persistent. And so finally, I talked to the supervisor who said, no, don't. And finally, I went to the CEO of the hospital. I made an appointment. I went in and I said, I have this idea that we could solve the problems if we move the pediatric unit back to the old part of the hospital and build this progressive unit so that we can take care of patients more effectively. And he said, well, how are you going to get the pediatricians to move to the old part of the hospital? And I said, well, I think that's your job. And he said, no, I think that's your job. He gave me a challenge that was probably in his mind impossible. But I made an appointment to go to the pediatrics meeting. And I told them my idea and they started laughing and they said, go back to work. And I thought I didn't convince them. So I said, the next month, can I come back? And I told them a story of a patient. And they said, we really feel for that, but go back to work. Over 6 months, I went back every month and I learned how to build the will for change. Every month I would go in and I would tell a story of a patient who was stuck in the emergency room or had to be transferred away or was in the hallway in the ICU. And then I learned that it can't just be the story. That convinces some, but not all. So then I extrapolated at the meeting to how many other people were in the same boat. So I started with story to reach the hearts. Then I extrapolated to tell them this is not an isolated problem. Then I talked about the human cost of these transfers. And then I talked about the financial cost. And I learned that you can really build the will for change if you use an arc like get to the heart with the story, because we as nurses see things in a different way. You've got to tell those stories, but then extrapolate to the total population, talk about the human cost, talk about the financial cost. They gave me the unit. I got to buy all the equipment and set it up, but it gave me a visibility and a sense of purpose that my vision could actually make a change. Because of that, I think I was promoted to be the chief nursing officer in that hospital and then the chief operating officer. And when I was 34, I was invited to be the chief executive of a hospital for the first time, a young woman, a nurse, taking over as CEO. And I learned a lot about how do you build the will for change? How do you represent what nurses see and do in a different way? And then after a few years, Dawn Berwick and I began to work together on quality, and IHI was founded. I ended up as the COO and then the CEO of IHI for about 20 years. I never would have had this career pathway if I didn't have, I won't say it was trust, but it was a challenge from the CEO of the hospital. So from that moment, I have taken it upon myself to reach out to young people, especially nurses, and say, share what you see because it's important. It's unique in the healthcare setting, and helping people to learn how to build the will for change. It's been a wonderful journey for me to take what I learned personally and begin to share. In the United States, we have a mission to get nurses into CEO roles, to get nurses onto boards of hospitals, and to get nurses into legislative positions. And we're now seeing in the city of Seattle, Washington, all the head of the Department of Public Health, all of the major roles in that city are all held by nurses. And it's just a wonderful thing to see that our view and our skills and talents can reach so many people. So I have a wonderful panel here today. from all over the world. We've got a fantastic group, and I have a few questions for the panelists. I'm going to start with this question. Thinking back on your own career, who had the greatest influence on you, and what did they do? What did they say? How did that influence demonstrate in your work? And we'll start with Dr. Shirley Luz, who's the CNO and coordinator for education in the Ministry of Health in Israel, and Professor Lisa Bayless-Pratt, who you've already met this morning. And I'd ask first, Shirley, if you would start and share who had a great influence on you and how.
The greatest impact of is for me is for my current manager, Dr. Shoshi Goldberg, the Chief Nursing Officer of Israel. She inspired me to have a vision and a mission, to work according to an annual work plan while setting long-term goals, so I could set for myself some short-term goals. Alongside setting goals, a manager and any nurse should have data, some kind of managerial dashboard, so you can follow your status, achieving your goals, and using the data as an argument to ask for more resources or to demonstrate your achievements. Furthermore, working and collaborating with partners, as you said before, and multidisciplinary teams, and as you said before also, having and creating a network of professionals working together while staying connected and available for every nurse and every employee. The last thing, and for me personally a very important thing, is the autonomy and the confidence I enjoy, so I can concentrate and think in a creative and innovative ways forward achieving my professional goals. Thank you.
Oh, thank you, Shirley. I love the idea of having someone sit with you and help you to set goals, and then also sharing with you how to use data. That's kind of the same journey that I was on. And then really encouraging you, I think, to think in a different way. That's fantastic. Lisa, how about you?
Yeah, thanks, Maureen. And I've thought about this for quite a bit, because there's been so many fantastic people, not least you actually, that I'm inspired by every time I hear you speak. But I think on this occasion, one of the people that really is close to my heart forever is the first ward sister that actually I was under the leadership of. And it's a kind of slightly, sad story, but with a good ending. And when I was just about to qualify, I went onto this ward to do my last placement as a student. And really tragically, my brother got killed on a motorbike, and he was 25, all very, very horrible and traumatic. And I didn't know what to do with myself, and weirdly, I thought I wanted to go and work in neonatology. And the ward sister said to me, "So what are we going to do then, Lisa? I'm in, it's all chaos." And she asked to see me. And I said, "I don't know." And she said, "Lisa, why don't you just come and work here? We will look after you. We will support you. And I am sure you will go on to do great things." And, she did everything. Every Tuesday and Thursday afternoon, she worked on shift with me. She developed a fantastic preceptorship program. We then had a policy change and I went to work in critical care. And I was just sitting here thinking about when I left that organization. She gave me a little crystal book, and in it said, "The world is your oyster." And I think, given the work that we're doing today, I could almost cry at this, but it's really that compassionate leadership that stuck with me, and she never stopped me. And I know she didn't want me to go and work in critical care, but she knew I had so much to do. She let me go, but never was far away. So I think it's, my first ward sister is someone that changed the game for me, for absolute sure.
Oh, that's such a wonderful story. And I feel terrible about your brother. I also lost my brother to cancer when he was young. And it really does open your heart to compassion. I do think nurses see things in a different way, and we feel things in a different way. And then when we add that passion and that mentoring to what Shirley was saying, the data and the goals, really, it's such a wonderful pathway to building a better future for us.
Yeah.
Thank you. Thank you both. Our next question is going to be to two other folks for our panel. What advice do you have for young nurses to see they see the potential and they see the need for change? What's the best advice you might give to them when they see it and they want to make changes, but they may feel a little uncomfortable about that? And we've got two wonderful panelists, Ariani Pertwini, a young student from Indonesia, one of the first winners of the Nightingale Challenge Global Solutions, who created with her team an approach to thinking about community and the health in the community. And she and her team are now being mentored by Lord Nigel Crisp. And Charlotte Jakib Hall, safe care specialist nurse from the Gloucestershire Trust in England and the founder of the Blogger Nurse Network. So Ariana, we'll start with you, Ariani.
Okay, thank you. It's a pleasure to be here together with excellent role models in nursing world, and really grateful to be in one session with one of role models in nursing who I admire, Maureen Bisognano. So Ramadan Mubarak to all of you who are celebrating. So about advice that I have for young nurses who see the need and potential for change. I would like to mention 3 points. First, find a mentor. Could be someone you admire, have lots of experience, and of course, the most important thing is willing to be your mentor, because you are young. Maybe you do have knowledge and most of the time idealism, but you don't have much experience yet. So a mentor will help you to identify realistic steps towards your goals. Find ways that you might not know before in your setting. Second, boost your communication skills. Change for most people is scary. There are many people who do not like change. So it really needs good communication skills to convince people about your ideas. What I mean with communication skills is also include strategy to communicate. There is a book, one of my favorite books. The title is Our Iceberg is Melting by John Cotter. It gives example how you deal with status quo as a youngster. Start from your closest network, but strategic, and go up and larger network. Third, build your network. Connect to people not only from your field, but open yourself as wide as you could, because you don't know when you will need that network, the relationship, to support the change you bring. So one more time, 3 points: find a mentor, boost your communication skills, and build your network. Thank you, Maureen.
Oh, thank you, Ariani. I love your idea about perhaps, idealism. And when you were saying that, I was thinking ideas and idealism, and nurses bring both. And the other thing you said that I loved so much was maybe the network building should be outside of your sphere and bring ideas in. I'm always telling people to work on your CQ, your curiosity quotient. We've got great IQ and wonderful EQ, empathy quotient, but we need to work on CQ, and that's what you're speaking to, Ariani. Thank you. Charlotte, how about you?
Thank you. Yeah, and I think I just want to say it's been amazing to just hear the stories so far that people have said. It's just really inspiring to have that shared here. So thank you for those stories. So to me, the advice that I would give any early career nurse is that you should always be courageous and remain as authentic as possible. And I say those things because actually, Maureen, you kind of, alluded to this with building the will to change. It doesn't happen overnight. Nothing good happens quickly. Nothing good is easy. And I always try and remind myself of those things when I'm trying to set goals or achieve new things or be innovative. And actually, I found myself looking a bit lost in my earlier parts of my career. And I found that I needed somebody to hone in those goals, those skills, and I sought out a coach after advice from some senior colleagues, and that was one of the most beneficial things I did. Even now, it helps me facilitate my ways of thinking and my frustrations into actual action and active work. And my coach says to me this phrase, that innovation sits on the edge of rules. And I love that phrase. And I literally take every day with those phrased words and think, how can I break those rules that sit on the edge? It's about working through the uncomfortable sometimes. But as I said, good results and positive changes come from challenging situations, from that need to be able to develop further and grow. And actually that just personally and professionally develops us ourselves. So that would be my advice to any early career nurses.
Oh, I love your thinking, authentic and courageous. And I love your advice about getting a coach. I mean, that's really powerful because innovation sits on the edge of rules. That goes into my heart because at IHI, we ran a whole campaign called Breaking the Rules because everybody gets so stuck in them. And if we're going to innovate and we're going to really make care better, we really need to understand that some of those rules don't apply anymore, but it needs that kind of innovation sitting at the edge of it. Thank you so much, Charlotte. Our third question is going to be a question about this time of COVID. And I think in this time of COVID, we have seen, at least in the countries that I have visited, not physically, but through these kind of ways, we've seen nurses' reputation change. We're seeing that people are starting to understand the impact that nurses have on health in the community and on healthcare when people are sick. And it's a time, I think, that we really need to build on so that we don't lose what we've built during this tragic time. So my question for our last three panelists is, in this time of the pandemic, do you think, what can we do to assure that we achieve the SDGs of health for everybody by influencing either through the government or through leadership tracks? What voice should we be bringing to assure that everybody in the world understands and appreciates the role of nurses in health, and that we change the structures and the laws to assure that this will happen? And we've got three great panelists here. Alice Thompson is a nurse from Scotland, and she's been helping a lot with the research for the Nurses Now report. Ellen Petra from Indonesia, another winner of the Global Challenge Solutions Initiative, and Stefan Ose, a final year of nursing school from Ghana. I haven't been to Ghana in a while, but I hope to meet you when I go next. And again, with the team winner from the Nightingale Challenge Global Solutions Initiative, and now being mentored by Jenny Clark, the CEO of SameU. So Alice, let's start with you, please.
Hi, so yeah, I think something like you said, COVID has allowed, nursing has been thrust into the spotlight over the past year. And I think it has brought up some challenges. It's been beneficial for nursing as well. But I think it has shown to the higher up levels, governments and things, that investment is needed into nursing as a profession. We make up 59% of the health workforce globally. And I think it has shown that actually you can put as much money into health, and finding cures and vaccines have been a big talk recently. But if you don't invest in the workforce, you're not going to get very far. And I think that is key. And it has been shown through COVID that actually we need to look after our nurses at all levels. We need to invest to provide more jobs. We need to train more nurses. You can't invest at just one level. It needs to be as a whole, because if you're not looking after the people, they're not going to stay in the jobs. And I think that is something that COVID has really highlighted. I think it has been quite bittersweet for nursing, COVID. It's been one of the toughest years I know personally for me in my career, my short career so far. But I think also it has shown that we have so much potential as a workforce, and so much can be done if we just are given the opportunity and the platform to do it.
Thank you so much, Alison. I so agree with you on investing in the workforce and investing in education. We have a huge potential need for nurses. And if you look at the math, it requires an investment right now, today, to assure we get health and care in the future. Thank you. Alan, how about you?
Okay, thank you, Maureen. So it's a good opportunity for me. So if I want to interpret your question is why should we investing in nursing like now? Because as we know that since 2015, many countries declare their commitment to achieve SDGs by 2030, and it show many progress actually. However, based on USC Global Monitoring Report, at least half of the world's population still cannot access essential healthcare services, and many people are being poor due to health spending. And it may get worse when COVID-19 pandemic hit us very hard, and it has disrupted its progress. If health for all is still our goal, growth in the provision of essential healthcare must greatly accelerate. At least I have three strong points, actually continuing what Ali said before, why we should invest in nursing to tackle these issues. First, nurses occupy up to 50% or more than 50% of global health workforce, which indicate that healthcare system really relies on their nurses to build healthy society. However, we face nurses shortages based on the last year's report. Can we imagine if number of nurses keep decreasing year by year? Healthcare system will collapse when its backbone is fragile and lack of investment by its government. And the second point is nurses can be found in every setting of healthcare, not only in hospital, but also health promotion, disease prevention, health management and improvement. This broad scope of contribution are essential factor while investing in nursing must be best for the national healthcare system. And the last one, we're glad that nurses is namely as most honest and trusted profession in several countries, including USA, UK, Australia, and many more countries. It indicates that our bonding with community and our closeness with our community is created as we implement holistic and comprehensive approach since we are on pre-service education. Hence, in short, we need global investment in nursing in the areas of education, job practice, and leadership. And when should we start to invest in nursing? The answer is now. Thank you.
Isn't that a great example of building the will for change? Using data, telling examples, and looking at particularly the settings that nurses are in every setting. You know, you sort of put a deadline on it when you said 2030, and this is what we need to do now. So fantastic. Thank you very much, Alan. And how about you, Stefan?
I think Alinda and Alice have spoken much on what we need to do and why it's important to invest in nurses. I would say, like they said, we form 50% of more than 50% of the workforce, and surprisingly, we are not enough. There's the need for more nurses everywhere, and it's just self-evident that nurses are needed in all community settings, and we are crucial in achieving all the goals the world has set: universal health coverage, SDG goals, and other related SDG goal for health and other related goals that we've set so far. I would say supporting or investing in nursing is not just necessary; it is the lifeline for communities' well-being. It will lead to expansion of access to healthcare and addressing inequality and poverty. So I think in ending, I would say that COVID-19 has highlighted our work enough. The government have seen, the people have seen us. I think it is about time. I would say to governments around the world, we appreciate your cheers. We love your words of encouragement, but we urge you, support us, invest in our education, in our retention, and in our leadership. Thank you.
Oh, Stefan, that was great. You reminded me of looking at powerful speakers building the will for change. I love how you laid out the number. We're over 50% of the workforce, but then you said, but it's not enough. And then you use the word lifeline. And that's how we build the will for change, by creating the lifeline, making it very clear that although we're a big part of the workforce today, it's not enough. And the timeline is now to begin to build the workforce of the future. All of you, I think it's been wonderful that you've also highlighted the need for us to take care of the nurses in the workforce today. We're seeing burnout and exhaustion. And if we don't step in and take care of each other, then I really do fear for the pipeline of the future. Well, I can tell you, I feel excited and maybe like I can retire now, because here is the leadership team across the world of the future who are so able and articulate in laying out the problem and some solutions. And I'm so grateful to all of you for joining me on this panel today. Harriet, I'm going to turn it back to you so we can do some questions in the chat or online. Thank you all.
Thank you very much, Professor Maureen. It's been indeed great hearing those great stories, inspirations. It's so amazing that we have the future of nursing and midwifery leadership. I can share something small to show us all that we are the future of nursing and midwifery workforce. Yesterday I had an incident, and I know it might be sad for some of us. There was an unknown young girl, probably a young girl in my community, who did unsafe abortion and had to dump the fetus at the garbage pit. So they had, the members, community members called me because I was in office. They came to me to go and see and probably do something. When I went, I noticed it was a fetus of about 8 weeks, and I had to allay the anxiety of the people and the children around, and I called the municipal health officer, who told me it was a police case. I myself took initiative to run to the police, and I came with them. They went through all the processes they have to go through, and they marked the place and took away the fetus to the hospital. But it was my first time to hear good words from the policemen, because I did not used to interact with them much, but I took them to my office and we had a long conversation. They said, "You are a different midwife. We had never seen this. And we hope to work very well, even in the future, in improving the health of our community." I was so humbled because of the act that I did to help the people around me, and also in the future to provide information about abortion and sexual reproductive health. So we are the change that we want to see. Thank you very much, our group of panelists. Allow me introduce the question and answer time. We have about 16 minutes to finish this, and we shall close the webinar. One of the participants, Aziza Shaheen, asked, "May I request ICN to visit Pakistan?" I will throw this to Shirley, the CEO of Burdett Trust for Nursing, if she can respond to that.
Harriet, it might be handy. I don't know. Perhaps I can support that one as well. I don't know, Shirley, if you are.
Shirley's back.
Yeah, you go, Lisa, on that one.
Yeah, I mean, I think what's really important for us with the Nursing Now Challenge and having the Burdett sponsorship is that we stay really close to the International Council for Nursing, and where we can connect on areas of mutual benefit, we absolutely will. So we're keeping the ICN, such a fantastic organisation, very close to us from the Nursing Now Challenge perspective. And I know, Shirley, that you work very closely with the Chief Executive too. So I don't know if you want to throw anything in there.
Well, just to say that we will pass on that message, but obviously it is a different organisation, but we will try and connect with them.
Thank you so much. And I also just want to as well respond to Aziza and say, possibly this is an opportunity for you as a young nurse to step up and possibly look into your nursing association within Pakistan and raise this to them as well. This is an opportunity for you to raise your voice. So that's an amazing question from you. I see there's a second question that Aziza has raised. Is it possible that all nursing councils worldwide collaborate with each other and make a uniform service structure for nurses? I'd like to ask possibly Louise on partnerships. I think it's a question that's aligned with partnerships. Louise, would you like to respond possibly on partnerships again, and just highlight again on the importance of partnerships and how councils worldwide can collaborate with each other?
I can talk very generally about partnerships, certainly as a model for joint learning and greater things coming out for both parties. So certainly within the work we do with health partnerships, including through professional associations and professional councils, we see that both parties can gain and can benefit from coming together and sharing what they know, what they understand, what challenges they face, and how they've overcome them. As many of you have shared today, the situations you faced and how by working and discussing with others, you found solutions. I think the solution you just suggested now, Monashi, was a really great one to suggest that the person that raised the question think about what they could do as well. So I think partnership is a really strong model for addressing problems, priorities, and coming together with solutions, and each party learning from the other. Thank you.
Thank you very much. Aime asked, can we apply for a mentor if we are still students? I can answer something about that I didn't have to apply for a mentor, but there are always those nurses and midwives around you who inspire you, whom you think will develop you when you bring them closer. My mentor, Dr. Grace Edwards, was my faculty when I was doing my Bachelor of Science in Midwifery. She noticed I was so enthusiastic about bringing a change in maternal health of Uganda, and I had to take my vision to her, that this is what I want to contribute around adolescent health. And she picked interest. She saw I was so interested in the change that I wanted to see. I kept on giving her feedback, and she really loved supporting me. Not until I was selected by ICM as a young midwife leader, and when we started the formal mentorship program, it encourages us to choose our mentors. Those are the people who are close to us, who are our friends, and whom we think they will benefit us. So I had to select her, and she became my formal mentor. And right now we are in the journey of growth. It is always a mutual understanding, a mutual benefit. You as a young nurse or young midwife may think your mentor will not learn from you. But my mentor has already said, Harriet, I'm learning from you. That means she will enjoy the process and you will enjoy the process. However, she's so interested in seeing you grow. Every step that you take, she's happy by that. I'm also having another mentor called Mr. Cliff Asher Aliga. He's also a faculty at Aga Khan University. They are supporting me together with Dr. Grace. And every step I take, they are on tight marking with me. I can say even right now, Cliff is teaching me monitoring and evaluation. I have not gone to the institution of monitoring and evaluation to learn that. But he said, we shouldn't get someone to do this. You should do this. And right now I'm doing it. That is mentorship. Do not take it so much as you have to apply, and you might end up getting someone who will not develop you or who will not get time for you. Thank you very much. Monashi, please introduce another question. Thank you.
Yes, sure. Thank you so much, Harriet. And I noticed we've got a question from Amy or Casitas. And Amy asks, can we apply for a, sorry, that's the question we just answered. How can we participate as nursing students? I think your question is around participating in, possibly it could be in as part of the challenge, as the Nightingale Challenge, and possibly also general participation as nursing students. So I would like to ask possibly Lisa, if she can be able to highlight on how nursing students can participate, and maybe also Ariani, if you can also be able to highlight after on how students generally can get involved and be part of advocacy.
Brilliant. Thank you so much, Manashi. Well, the short and sweet answer is we want to get student nurses engaged in the next phase of the Nursing Now Challenge. We're just working through the detail and understanding how to make this work. But I think the opportunities for mentorship of early career nurses with students and senior nurses with early career nurses, that whole pathway of support is something that we are planning to build in to the next phase of the programme. So watch this space, but absolutely, yes, we want student nurses involved. And we're so proud of some of the Nightingale Challenge solution winners that indeed have stepped forward as students. So I can't wait to hear from Ariana now about her contribution.
Right. Thank you. So as a nursing student, I think you can tell your ideas to your professor, your faculty and faculty member. Like in our school in Gajah Mada University in Indonesia, we in School of Nursing, the administrator really open to students' ideas. So by doing that, you can build your network and then work together with the faculty member to contribute. I think that is one way that you can contribute. Thank you.
Thank you very much, Ariana. I'll bring in another question from Craig. He says, as we know, and as COVID-19 has highlighted, healthcare and disease knows no borders. So as the future nursing and midwifery leaders, how do you think we can best link up to share best practice internationally? As reading the State of the World is Nursing report, there is so much that we in higher income countries can learn from lower and middle income countries.
Yeah.
I will throw this to Louise.
Thank you very much, Harriet. Yes, I think this is a really key point, and I think that the work we have done has really shown the benefit back to the UK health workforce and the health system by engaging in partnerships with peers in a range of low and middle income countries. And with COVID, as Craig rightly states, we're seeing lots of good practice in a number of lower and middle income countries who have more experience of responding to this sort of crisis. And they're also much more used to working with limited resources and having to be creative. So I think there's a lot that the UK health workforce can learn from peers and colleagues in partner countries. So I think initiatives like the Nursing Now Challenge, which is helping to bring together nurses from across the globe, is one of these initiatives, but also some of the work and programs we do where there are opportunities for peers to come together and work and learn together. We are also, as part of our work, trying to establish a community of practice, particularly around COVID, in fact, to share learning across the health workforce. So I can share some details about that platform, which we're launching shortly. The Pulse platform, it's called. It's available, but not fully ready yet. But I'll share details of that later in the chat. But I think there are a range of those sorts of mechanisms where peers and colleagues are coming together, where ideas can be shared, and it's really taking advantage of those spaces and those opportunities to listen to and also be open to learning from colleagues from low and middle income countries. There can often be a sense that the partners in the higher income countries have more to share with their peers, but it's often the other way around. Thank you.
Thank you very much, Louis. You are very key in global partnerships, and you have indeed helped us on that. We have 4 minutes to go, and I will read this question. Hazel is also interested in mentorship program and is asking how can we take part on it. I will invite in Lisa to throw a little about mentorship. I shared about my mentorship experience, but you could be having a different perspective as a global leader within Nursing Now.
Thank you so much, Harriet. And it's such a brilliant question. And to be honest, something that we want to put much more focus on. Every webinar, every piece of feedback we get from our Nightingale Challenge participants tell us that the reason that it's been successful is because they've had a strong mentor. So what we're looking to do now is find the best way to find mentors for our Nightingale Challenge participants. And we're really interested to hear more about this, and we've put out some polls on Twitter, and we'll be doing a lot more work around this because we think there's lots of opportunities to tap into some of the leadership programs where senior people are wanting to become executives and would really value early career nurses and midwives in a reverse mentoring situation, or indeed having the opportunity just to connect and listen to many people that are working right at the cutting edge of practice. So we absolutely realise, and the report that will come out around the Nightingale Challenge and the Nursing Now programme, it really shines a light on the importance of mentorship and how to make it effective and how to make it work. So there's a lot of work going on in this space, but if anybody on this webinar wants to put themselves forward to be a mentor or has got some great ideas, then please do let us know, because we want to build a set of resources around this and grow a mentor network to support early career nurses. And I also think this reverse mentoring, the opportunity for early career nurses to give insight to senior nurse and midwifery leaders, has got a lot of potential and will be incredibly powerful if you are on a fast track executive journey, you know, to become a top leader within your organisation. Thank you, Harriet.
Thank you very much, Lisa. And I'll invite my co-chair, Munashi, to give his closing remarks if there is no other business.
Awesome. Thank you so much, Harriet. And thank you so much, Lisa. I think you've just given an amazing close to this wonderful session, and really energized about the Nursing Now Challenge and seeing the future that has really been on display this afternoon through this panel. I just want to thank everyone for being able to join us this afternoon. And I think really this platform really highlights all that is possible and all that we can do as young nurses if we come together, if we join together, and if we raise our voices in being effective leaders for tomorrow. I really want to thank my co-chair, Harriet, for the opportunity to be able to co-chair with you this afternoon. It's been an amazing session.
Oh, thanks, everybody.
Thank you very much, Monashi. I'm indeed humbled to co-chair with you. It's been a great experience. We have enjoyed it. And we would love to encourage everyone there to come up, do something. I want to say thank you so much to Nursing Now, Burdett Trust for Nursing, Nightingale Challenge. I want to send my regards to Uganda nurses and midwives leaders, the coordinator of Nursing Now, Mrs. Catherine Odeke, and Seed Global Health for supporting nurses and midwives in Uganda, National Healthcare Conference, Elizabeth, for supporting nurses and midwives, and also the Commissioner of Nurses at Ministry of Health, Mrs. Beatrice. Thank you very much all. We want to say bye-bye. See you soon.
Thank you, Harriet.
Bye-bye, everyone.
Bye-bye, everyone.
Bye-bye, everyone.